Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. From Thursday local time in the UK, COVID passes and rules on masks in public places will be completely revoked. British Prime Minister Boris Johnson under fire politically for secret alcohol-fueled parties at 10 Downing Street, while Britain was supposed to be on a very strict lockdown, also said this month that he expects to scrap mandatory isolation rules by the end of March. The UK government also says school-age students in England will not have to wear any kind of face coverings in school, and that includes classrooms, corridors and other communal areas.
Immigration and related quarantine rules have also been softened. However, the British government continues to suggest masks be worn in enclosed and crowded places. These new rules apply to England instead of the whole UK, as COVID-19 restrictions as part of health policy are a devolved matter. For more on this, we connect to Professor Michael Toole, Associate Principal Research Fellow at the Burnet Institute in Melbourne, Austria. Good morning, Professor.
Good morning from a very hot Melbourne.
Well, firstly, I want to start with your reaction on the UK's move. Do you think this is the right decision, and do you predict other governments would follow Britain's move?
Well, I think there's been a bit of a pattern in the UK, in particular in England, of easing restrictions when they're still reporting high numbers of cases. You recall they did this back in July when they were reporting around about 50,000 cases a day, and they got rid of all restrictions. Cases continued at about the same rate until Omicron arrived, and of course they had a huge peak. At the moment, they're still reporting about 100,000 cases a day, and the number of deaths is increasing. So I'm very surprised. And from a public health point of view, I don't think it makes much sense, in particular, to remove the fairly easy restrictions like wearing masks indoors.
Right, I just want to apologise because Morkyan said you might be in Austria, although considering how hot it is in Melbourne, perhaps you wish you were in Austria at this point. Now, there seems to be two really firm camps of thought that are very heavily entrenched now about COVID-19. One saying, look, it's just time to live with the virus now, much like we live with influenza. The other camp saying, no, we're not out of the woods yet. We need to keep these restrictions in place, perhaps even toughen them. I know there's a grey area here, but if you had to choose one side of those camps, which one would you be in?
Well, I'm certainly not in the camp that says let's just live with it. From my point of view in Australia, where we've been reporting up to 100,000 cases a day, with a much smaller population than Korea, deaths are rising now. So we had 85 deaths yesterday. That's more than ever. Keep in mind that the influenza is a seasonal disease. It occurs during the cold season. Right here in Australia, it's the hot season, and we're seeing more cases than ever. So I think that's one reason not to compare COVID with influenza. I did a bit of homework last night looking at the number of influenza deaths per year over the last 10 years in both Australia and the UK. Now, the number of COVID deaths has been far higher than any year during that period. In fact, here in Australia, we've reported as many deaths in 1 month in January as we did in a record influenza season in 2017. And the UK is similar. So I think comparing the two is not appropriate. They're very different viruses, and they spread very differently. And as we know, Omicron is spreading much faster than any other variant we've had. So I think we should maintain those restrictions that don't disrupt the economy and they don't actually impact on our personal lives very much. And they include masks indoors in all settings except at home. And I also think vaccine mandates are very important to give the public confidence to go to, say, a restaurant and dine without fearing they're sitting next to a table of unvaccinated people.
And Professor, while the UK is scrapping its restrictions, the US government seems to be, trying to double down of its restrictions, regulations. But data appears to show that Omicron is burning out in the US as well. So as a medical expert, do you understand why the Biden administration is resisting rolling back measures?
Yes, well, I think it's important to realize that the situation in the United States is very different in different parts of the country. So yes, overall there's been a decline in the number of daily national cases, but that's partly because there's been a decline in the heavily populated states like New York, whereas in other parts of the country, numbers are still going up. So yesterday, the US reported about 600,000 cases. And even if Omicron is mild at the individual level, at the population level, that will lead to many hospitalizations and deaths. So I think it's wise for the president to look at the country as a whole and to take those precautions that are proven, for example, N95 masks, which are being provided free, and rapid antigen tests that will help people diagnose their condition very quickly at home. So I think the US is taking the right path.
And finally, I just wanted to touch upon a topic that some people find rather controversial. And you mentioned that you're kind of pro-vaccine mandate. But new research does show that there seems to be a lack of trust in political leaders and in experts as well. And this is part of the reason why a certain section of the population is refusing flat out to get a COVID-19 vaccine. Why do you think so many people are so hesitant about taking the shot? I mean, to be fair, we are hearing numerous reports of sometimes severe side effects. So do you think, in a certain respect, their concerns are justified?
Well, again, Mark, the situation worldwide is not the same. And from what I have read, the highest levels of hesitancy are in Eastern Europe, including Russia, and in some low and middle income countries, in particular in Africa. Other countries have achieved very high levels. Now, we all know that Israel was ahead of everyone else in rolling out the vaccines, and yet they can only achieve 65% coverage rate, and they're now experiencing the highest surge since the pandemic began. And that's because some elements of the Israeli population are cynical about the government and about the vaccine. I won't name them, but you can easily find out who they are. As for side effects, one side effect of the Pfizer and Moderna vaccines that has concerned some people is an inflammation of the heart. Now, data now clearly shows that if you get the virus, you get infected, you have a much higher, up to 10-fold chance of getting inflammation of the heart than with the vaccine. And the vaccine-induced heart inflammation has been very mild. There was a huge study of the US military that found that hospitalization was just for observation. There were no deaths and no one was admitted to ICU. So I think particularly for these mRNA vaccines, we should have a very high level of trust. And coming back to the problem with not trusting politicians, we need excellent communication strategies that target different groups, the elderly, for example, young people, women, pregnant women, and make sure the message is tailored to the needs and concerns of each of those groups.
All right, Professor, thank you so much for coming to our show. We appreciate your insights.
Okay, thank you. Have a good day.
Thank
Good
you.
day.